The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Thank you everyone for attending. We hope that you will find this to be an educational piece for you to help you on your journey. And as part of that, we kind of want to cover many of the basics as to what you may be experiencing. When many patients come to see us with erectile dysfunction, they often ask, why? Why is this happening to me? What's going on? So that's the first thing that we'll discuss today. It's really important to actually understand what is going on inside of your body when you're trying to obtain an erection. When you understand this process, you can then have an understanding as to why this may be challenging for you. In general, the first part that you need is signaling from the brain. The brain will send a signaling through the nerves to the blood vessels around your penis, and those blood vessels around your penis will then open up and allow blood to enter into your penis to allow it to become engorged and allow it to become erect. So you need good blood supply into the penis and you need good nerves. In addition to that, what happens as your penis becomes engorged and full is that the blood then becomes trapped inside of your penis so that you can maintain the erection. Typically, blood leaves through what are called veins. So as you get a strong erection, these veins become closed and therefore the blood can stay inside of your penis. Now that you understand this simple process, you can now imagine that if there's any challenges with the nerve signaling, this could be from diabetes or a spinal cord injury, for example, or if there's any issues with not enough blood entering your penis, that could also be from diabetes, high blood pressure, vascular disease, even from radiation therapy, for example, or surgical therapy for cancers. Then you're not going to have enough blood flowing into the penis. And then there are some patients who have what we call high outflow. That can happen just the way that they were born, or it can sometimes happen from trauma. And therefore, they just don't have the ability to keep the blood inside. So we'll talk a little bit today about what treatments exist in order to help to counteract this erection process. Next slide. So what we'll just be discussing today is what is called the vacuum erection device. And the next slide, we'll talk a little bit more about what types of devices exist. So the first thing that's important to understand about the vacuum erection device is that it is FDA approved. What that means is that this is a device that has been vetted and needs to pass a criteria in order to receive that approval from the FDA, and it's been around since at least 1982. The vacuum erection device has several names in which it is commonly referred to. It could also be called VED for short, vacuum therapy system, and even penis pump. The way that this device works is that there's a hollow plastic tube that is placed over the penis. There are different versions of these type of devices. One can be a manual version as seen in the picture on your left, or a battery-powered version on your right. Basically, the either manual or battery-powered basically apply a traction and a suction to the penis, and that brings blood into the penis to allow you to obtain an erection and to allow you to develop that engorgement of the penis. However, as you remember, as we discussed in the prior slide, it's not just about bringing blood into the penis. The blood has to stay in the penis for you to be able to maintain that erection. So therefore, these devices also come with constriction rings, and these are placed at the base or the part of the penis that's closest to your abdomen, and that helps to constrict or squeeze around your penis to trap the blood inside. People can use these type of vacuum erection devices for a variety of reasons. That could be for sexual activity. It could be for penile reconditioning. And even some patients may use these devices to help to reduce scar tissue or even to help to reduce curvature of the penis as well. The vacuum erection device is helpful and can produce an erection in over 90% of men. And we'll talk a little bit more about in the next slides about how actually that is done. And we'll talk about tips on how to get the best outcome from this type of equipment. So when I talk with my patients, and if they are interested in a vacuum erection device, the first thing that I talk about with them is that it needs to be optimized for the individual person. Just like anything that we do in life that's new, it does require some practice and it does require some getting used to what's involved. Just like using new orthopedic devices, they involve a variety of components that can be adjusted, changed, and altered so that it can give the best fit and the best performance. As we discussed, it takes some getting used to. So just like wearing glasses and getting the right fit, such as using a knee brace, as you can see in this picture, and as in crutches, we've all tried to use our own crutches or friends' crutches and know that the first time you try it, it just doesn't work properly. You do need to adjust them, and then you also need to get used to them to find out how to use them most efficiently. So this is an illustration of a vacuum erection device, and we have one that we will use together as well. The first component of the vacuum erection device in this picture is what we call a pump head. That is the actual part that will be producing the suction. And in this case, this is a manual suction device, and you can see that here. The next piece that you see in blue is what is called the penile tube. And that's the cylinder in which you're going to place the penis in, and the penis is going to be engorged inside to achieve that erect state. What you can see here at the end of it, which is labeled as number 3, is what is called the transfer sleeve. And you can see here in this picture that there's actually 2 types of transfer sleeves that exist. And they actually come in different diameters. These are different transfer sleeves that you can measure on yourself to find out which one best fits the girth of your penis and to provide the best fit. So many people ask, well, Dr. Chung, how do I know which band am I supposed to use? And when you get your device, it will come with a ring sizing device. And that looks similar to this. You can see that there are different sizes at the bottom, and you can simply just place your penis under each size to find out which one best fits you. The sizes are assigned a number, and then therefore you can choose a constriction band that is correlated to that size that best fits you. There are essentially 2 ways in which we can put the constriction rings onto the transfer sleeve. Once again, this is a transfer sleeve. One of the ways that you can put the transfer sleeve on is by directly kind of pulling the ring and placing it over the transfer sleeve. For some patients, that can be challenging, either due to hand dexterity or hand strength or coordination. Therefore, this type of loading cone exists in which you can apply over the transfer sleeve, and that allows you to have a graduated way to deliver the constriction ring onto the transfer sleeve. We have an excellent video which will be able to describe that process, and as I mentioned, we will also go through that step by step in person as well. So as we discussed, using a vacuum erection device takes time, and it also takes practice. Erectile dysfunction is a scenario that no one ever dreamed that they would have, and is a scenario that no one ever wishes that they had. There are many treatment options that we have for erectile dysfunction, and it's often we have to choose what best fits for what our goals are and what our motivations are, and that could be from a cost-benefit standpoint, that could be from an efficacy standpoint, and it could be even from a spontaneity standpoint. When many patients are trying to learn something new, they have the expectation that things are going to be easy and that things are going to be quick to learn. The learning curve for the vacuum erection device is easy and it is natural and it is short. However, it does indeed take practice still. when I talk with my patients, I really want them to have confidence with their sexual activity. Sexual activity should be natural. It should be something that's a transition for them. It should be something that they can kind of gradually or even quickly kind of engage into without much hesitation. So therefore, I always ask my patients when they're using the vacuum erection device to really spend a lot of time, even by themselves, just learning how it works. You don't want to be frustrated in front of a partner. Often using a vacuum erection device is a little bit easier when you have a supportive partner. As you see on the video, as well as in the live demonstration that we'll look at shortly, sometimes the mechanics of using the erection device are hard logistically with just two hands alone. So often having a supportive partner will make that part easier for you and also just help you with your general ease and confidence as well. Using and learning how to use a vacuum erection device does require following instructions as well as experimenting to find out what works best for you. Even though you may use the sizing guide and find a size that works for you, once you actually get into action, you may feel like you need a smaller size or even a larger size to be able to achieve the best outcome that you're looking for. In terms of using the vacuum erection device, there's different ways that it can be utilized, as we discussed, from sexual performance or to even penile rehabilitation, which we will talk about next.
Before you start, familiarize yourself with the contents provided in your Rapport Classic Vacuum Therapy device system. You will find the constriction ring sizing guide at the back of your Instruction for Use booklet. To use your Rapport Classic device, you will first need to determine the correct constriction ring size. You have received 5 constriction rings with your Rapport Classic device. Select a slot which fits firmly around the base of your flaccid, non-erect penis. Try the largest size first. Each slot has a ring size marked above it, which corresponds to the ring you require. The constriction ring is placed at the base of your penis next to your body, and choosing the correct ring size is important to maintain the erection for the necessary period. Once you have selected the right ring size, you're ready to begin. There are 2 transfer sleeves provided with your Rapport Classic system. Depending on the size of your penis, you should choose which of the 2 is likely to be the most suitable. Remember, your erect penis will need to be withdrawn through the transfer sleeve. One of the transfer sleeves included with your Rapport Classic system is already attached to the penile tube. If this is the correct size transfer sleeve for you, you can leave it in place. If not, remove it and fit the remaining transfer sleeve. Fit the loading cone onto the transfer sleeve and apply a little lubricating jelly, included with your system, on top of the cone. Holding the constriction ring by the outer handles, simply stretch and pull the ring down the loading cone until it slips onto the transfer sleeve. Make sure the constriction ring is located on the flat groove at the center of the transfer sleeve. The constriction ring is now mounted and ready for use. Before continuing, make sure you use the lubricating jelly to lubricate the end of the transfer sleeve. Also, lightly lubricate the penis to prevent it from sticking to the inside of the penile tube during insertion, or while using the pump. The pump head has 2 small pegs on each side above the orange ring. These should be positioned into the 2 grooves on top of the penile tube. The 2 parts are then locked together with a twist, so that the 2 pegs slot down and locate at the lower end of the groove. If these 2 parts are locked together correctly, it will ensure the unit is sealed tight enough to create a vacuum inside the penile tube. To ensure a vacuum will be created, insert only your penis into the penile tube and apply slight pressure to the seal with the transfer sleeve against your body at the base of the penis. To ensure that a vacuum is created, it may be necessary to groom the hair at the base of the penis. Make sure the constriction ring on the transfer sleeve is in the correct position, with the handles to the top and bottom. Continue pumping slowly to create the erection. If you feel any pain, stop pumping and press the release button to eliminate the vacuum. You can try again when you're ready. Pumping slowly is most beneficial. When the desired erection has been achieved, continue to hold the tube tightly against your body. Ease the constriction ring off the transfer sleeve and onto the base of your penis. Press the release button to lower the vacuum pressure and remove the penile tube. With the constriction ring in place, sexual intercourse can be accomplished. If a condom is to be worn, it should be put on as a last step. Please ensure that the lubricating jelly used with the system is compatible with your condom type. To remove the constriction ring after intercourse, simply grasp the outer handles to stretch the central ring. As the blood is released from the penis, it will decrease in size and the ring may be easily removed. Do not wear the constriction ring for more than 30 minutes at a time, and allow a minimum of 60 minutes between uses.
Great, that was an excellent video describing how the Owen manual VED works. And once again, we will look at that in person in a few minutes. So as we discussed, there's different reasons why people may use a vacuum erection device. Some of them is, the first is obviously for sexual activity, but also people use a VED or vacuum erection device for penile reconditioning. And we'll talk about that more in the next slide. So penile reconditioning is really for those who may have had some inactivity as well as even loss of nocturnal erections. We're trying to get a jump start to the penis. It is highly recommended for those who have been sexually inactive and no longer experiencing these type of erections. What we mean by nocturnal erections is that you should naturally typically obtain about 3 to 5 erections during sleep. Blood is a way to provide nourishment to your body, and it's just recreating that process of delivering nutrients to where things need to be delivered to. What we're trying to do with the vacuum erection device during penile reconditioning is manually recreating that process to bring blood flow in, to bring those nutrients, and to restart that process. Typically, when we are talking about penile reconditioning, we recommend patients to use this for about 3 to 5 days per week for approximately about 20 to 30 minutes each time. And this involves not using a constriction ring. Remember that the constriction ring basically traps the blood inside. Blood has oxygen inside, and eventually that oxygen becomes used and then eventually depleted. So if you continue to keep that ring inside, then good blood is not going in and out. So the purpose of penile reconditioning is to bring in that healthy blood within the penis to help to allow good blood flow in. So using the ring is kind of, not required during that scenario. Obviously, if after doing reconditioning, you like to use it for sexual activity, then the ring would be needed. So this is something that would be helpful if you talk with your urologist or your home providers closer to where you are about exactly what type of success they've had with this and what type of regimens work best. Next slide. So to discuss this a little bit further, the reason for why we don't want to use a constriction band is because we're not trying to obtain an erection that lasts for 30 minutes with penile reconditioning. In fact, we want to try to create an erection and be able to hold and stretch that penis for about 1 to 3 minutes. Then we want to release it. And then we want to repeat that process for a few more times, and in total for about 10 to 15 minutes for each training session. So once again, as you can see at the comic on the down below, we're going to go ahead and recreate that erection. We're going to be able to maintain that erection by holding that vacuum erection device tube against our abdomen and against our genitals to be able to maintain that seal so that suction is inside. And then in order to be able to release that vacuum, there's going to be that release button, as you can see in the diagram, which we'll look at it in person as well, which will release the suction and allow you to start over all again. So any person with erectile dysfunction is a candidate for the vacuum erection device. It is a device that can be used spontaneously and actively to be able to create and maintain erections for sexual intercourse, and it actually can help with different types of erectile dysfunction. As we discussed in the earlier slide, there can be patients who have nerve damage, who therefore can't get an erection. VED will help with them. There are some patients who are not able to get enough blood drawn into their penis, and that's what a VED does. And there are some patients who don't have the ability to keep the blood inside their penis, and that's what the constriction ring of the VED does. It's also important to understand that a lot of the, or all of the oral medications and injectable medicines that exist for erectile dysfunction, all of them are bringing blood into the penis, but none of them are really designed to kind of trap the blood inside, and that's where the benefits of the VED lie. It can be used for all sorts of patients, those who have developed erectile dysfunction from diabetes, from high blood pressure. It can be used in patients who are prostate cancer or bladder cancer or even colorectal cancer survivors as well. It could have been for patients who underwent surgery and lost their erectile dysfunction, or even patients who underwent radiation. There are different reasons why people might want to use a VED, and it doesn't mean that you have to have no erection in order to use a VED. That's completely not true. There are some patients, for example, who may actually do decently well with an oral medicine, but they want to do a little bit better and they need a little bit more of a boost. And that might be a great opportunity for patients to use a oral medicine plus a vacuum erection device. Many of you may have tried oral medicines before, and unfortunately, some of you may have had really intolerable side effects from those: headache, flushing of the skin, or even really stuffy nose, and you may not even be able to tolerate them. So therefore, sometimes you might want to consider using a vacuum erection device as well. Through your journey, I think it's really important for you to seek out care from someone who really understands erectile dysfunction and who can really offer all these treatments for you. During your journey, you may have heard that injections exist, and you may have also heard that penile implant surgery exists, but there are some patients who are afraid of needles or just don't want to inject themselves, and they're looking for kind of a non-medical way to obtain an erection, and also a non-surgical way to obtain an erection. And for many of our patients, actually, cost can be a major issue. A lot of these medicines, unfortunately, are not covered by insurance companies. So therefore, you have this continued incurred expense of buying the oral medicines or buying the injections, or some patients don't have the insurance coverage to be able to undergo surgery. So because of all of that, when you buy a vacuum erection device, it allows you to have one device that you can continue to use for as long as you have that device at a low cost. So it can really be cost effective for many of our patients, and that's something that people should definitely consider when they're thinking about how should I undergo and choose the best treatment for my erectile dysfunction. So with any treatment that we have for erectile dysfunction, we have to always consider the side effects. And this is where it's important to understand some of the experiences that you may have with the VED. So remember, because we're using the constriction band to trap the blood inside of the penis so that you can sustain the erection, that constriction ring is also constricting around your urethra. Your urethra is a tube in which urine and also ejaculate fluid escape through your penis. So if you have this band around the penis, it's also going to restrict your ejaculate from exiting as well. We recommend not using the device for prolonged periods, meaning no longer than 30 minutes at a time. And that's because if the band is too tight or left on for too long, it can cause numbness and it can cause discomfort. Remember, essentially, that when we are trying to maintain the erection, we're trapping the blood inside, and that's okay. That's good. That's what we're trying to achieve. However, by maintaining that erection for too long, eventually that blood will become deoxygenated and depleted of the oxygen, and that can be negative on to the penile tissue. By applying a suction to the penis, we can develop some bruising of the penis. So therefore, it's important to practice and also to develop the best technique to minimize these. But that's also why it's also good to get a device from a reliable company, because it's going to be FDA approved, it's going to have met those requirements, and it's going to have protection such as the vacuum release button on the device to be able to help you in case you experience any discomfort or whether you'd like to end the process earlier. So I think one of the benefits of helping to mitigate side effects is having good education. So that's why I'm proud of all of you for attending today's event, so you can start out with the right expectations. The other thing is getting a good device that comes with good literature and good videos and good DVDs in order to be able to help you understand how can I do this properly and safely. In terms of working with MenMD, MenMD helps to provide customer support for patients who have questions about the products that they get. And I think that's very unique. Some of you may feel have purchased these devices from Amazon, for example, or maybe even from a sex shop, and you're not going to get any customer support from those scenarios. So you really want to buy it from a reliable source so you can be able to get the information and support that you need. Once again, the VED may not be for everyone, and for many of you, you may want to consult with your physician or your urologist in order to make sure that this is a right treatment for you and a safe treatment for you. There are no rules in terms of whether you can or cannot absolutely use this with blood thinning medicines. However, that's a discussion that you need to have in terms of with your provider, so you can make sure that you're making the best decisions for yourself.
Alrighty, that's going to bring us up to our co-sponsor slide. So this webinar is co-sponsored by Owen Mumford. They are the makers of the Rappaport Classic Vacuum Erection device, which is pictured there. So we'd like to thank them for making this event possible. So we're going to transition now into the demonstration portion of the live event. So I'll pull down the slides and you can show them the device, Doctor.
Great. So we've looked at the video and we've seen pictures of what's going on, but let's delve in a little bit more depth and educate ourselves about actually the device that we're talking about today. Once again, this is a manual pump made by Owen, and this is going to be the pump portion of it, and you can see how this actually is applying a suction directly against my hand. And what's important about these devices is to understand that they have safety built into it. So this is going to be the vacuum release button that you can press if you want to immediately reduce that the vacuum and suction that you're applying to your penis. And that's important to have as a backup and as a safety for you. This is the penile tube. The pump, which we'll put on shortly, will be attached in this area. You can see that there are grooves in the side, and it will basically fit into that area and screw on. Once again, in terms of the transfer sleeve, which is here, there are two sizes of transfer sleeves, and as you can see here, there's different girths of the transfer sleeve that you can utilize for your best fit. And the point of the transfer sleeve, remember, is for you to be able to put the constriction ring on easily after you've been able to obtain that erection using the device. So we'll lower our camera here so you can see a little bit more easily. And remember, there are different bands that come according to different sizes. These all come with any device that you get, so you can get the right penile girth measurement. In terms of using the band, these are the two parts that you can use to stretch the band to be able to open up the opening, to be able to put it onto the transfer sleeve. For some patients, they find that they are it's easier for them to put it just directly over in this manner. For some patients, they might find it easier to use the transfer cone. The transfer cone just fits on the top and then allows the individual to have a graduated way to put the band over onto the device. For some patients, it may be challenging to do that based on hand dexterity. However, that's a small number of patients. Using some lubrication can help you to put that better on more easily. So once we have the constriction ring on the transfer sleeve, then is our opportunity to go ahead and put the pump on. I prefer not to put the pump on yet because often it's easiest to do this on a solid surface so that you have something to push against when you're putting that sleeve onto the transfer sleeve. So now we're going to go ahead and connect our device together, and then we're going to twist so that we have the appropriate connection here so that we can develop a good suction. One of the most important things is this portion is what's going to be pressing against your abdomen and which you're going to put your penis into. Sometimes in order to get good contact against your abdomen, you may need to do some grooming of the pubic hair to be able to get a better, more skin-to-skin contact. However, that may vary per individual. The devices do come with gel, and this is just standard gel. In case you needed any additional ones, you could use any one that you have. However, remember the gel can help you to slide the constriction band over the transfer onto the transfer sleeve using the cone. But you also want to use the gel in order to have a nice airtight suction against your skin. So you might want to, and will benefit from using some of that lubricating gel around the outside of the transfer sleeve, but also on the inside of the transfer sleeve as well. So now you can imagine this device is all set up. Many patients like to just keep it prepared because they want sexual activities to be spontaneous, and they don't want to have to go set anything up in preparation for sexual activity. So many patients will keep their device just like this, ready to go. And when the time for sexual activity comes, they can simply put it on and then pump into action. So let's go ahead and see here. This would be against the abdomen, and then this would apply that suction, drawing the penis into the penile tube, obtaining that erection. So remember, that's the part that's going to bring blood into the penis so that the individual can get the erection. Remember, the second portion is that now that the blood is in, we have to keep it inside. So we have to get this constriction band onto the base of the penis. And once again, the base of the penis is the portion of the penis that sits closest to the abdomen or closest to the body. This will happen typically in two ways. Some individuals will be able to just slide this off the transfer sleeve and onto their penis. Some individuals may have to use more of a two-handed technique to pull this off onto their penis. So this is one of the scenarios where 100% this can be done by a single individual by themselves. However, some patients may benefit or even prefer because they like to have their partner involved in their sexual activity and make it part of the foreplay, for example, and have their partner perhaps hold the device or slide the ring off or whatnot, whatever suits the sexual activity that you're looking for. So once this is over the penis, then the individual can then continue with the sexual activity that they're looking for. And once they've achieved that sexual activity, they can then slide it off and they will lose their erection. So one of the good things about the constriction device, as we discussed in the vacuum device, is that it's going to help patients with all different types of erectile dysfunction, whether it comes from the issues with nerves and their signaling, whether it's an issue with not being able to get enough blood inside, the vacuums can be able to draw it in. Some patients have the challenge of not having enough blood staying in the penis. That's where the ring will be able to help to keep it inside. And some patients even have a combination of all of those, which is causing their erectile dysfunction. One of the other good things is about using a ring and being able to keep the blood inside of the penis is that often when people climax, they're going to lose their erection naturally when they have a natural erection. But using the ring is going to help people to be able to sustain their erection, even though that they may climax to be able to achieve their goals. As once again, though, as we recommend not using it for 30 minutes to help to minimize the side effects of the device as well.
First question here, is an erection needed for VED use?
So VEDs are used for patients who are interested in improving their erectile function. So the whole purpose of the VED is to obtain the erection, so you do not need an erection beforehand. The VED, once again, does not need to be used for people who have no erection, right? Erectile dysfunction is a range. There are some patients who get really good erections, but it's intermittent or they can't sustain it. Therefore, a VED can help them sustain it and make it more consistent. On the opposite side of the spectrum are patients who get no erection, and the VED will be able to help those patients as well. So being able to get an erection is not a requirement for being able to use a VED. In fact, the VED is designed to help people to get an erection that is successful for penetration and for sexual activity.
Alrighty. Awesome. So I guess a little bit of a clarifier on that one is you need erectile function in order to use a VED.
You do not need erectile function in order to use a VED. The VED will induce that erection for you.
Alrighty. Sounds good. Next question here. Why does the ring sometimes cut off sensitivity to the penis?
So the ring is designed, remember, to trap the blood inside. In order to trap the blood inside, it needs to be tight enough to be able to keep the blood inside. We don't want the blood to leak out through veins, which in order to escape the penis. So it needs to have enough constriction around the penis. So not all patients will experience numbness. If you are experiencing numbness, you may just want to reevaluate whether perhaps a larger ring may cause you less side effect. And also, you also want to consider the duration in which that you are using the ring. But you can imagine a scenario where if you tied a string around your finger and you let that let the blood stay inside of the penis, and if you touch your finger after you've done that for a few minutes, it feels a little bit different and it perhaps feels a little bit numb. That's the exact same analogy and same process that we were creating with the vacuum erection device.
Alrighty. Next question here is a bit of a review, but why is age not a factor with VED use?
That's an excellent question. And actually, as a men's health specialist, age is never a restriction in terms of trying to get an erection. Many patients come to see me and say, Dr. Chung, I'm 72 years old. Am I too old to be able to get an erection? And I tell them, no, we have patients who are 80. We have patients who are 90. We have patients who are older than 90. So it's really all about kind of where you are in life and what your goals are. So the simple answer is no. There is no age restriction. There is no too old for using a vacuum erection device. As long as you have good health to be able to have sexual activity, then a VED can be for you.
Alrighty. Next question here. What is the best method to use the VED in order to increase blood flow, circulation, and just general erections?
Sure. So as we discussed, there is a method of penile, what we would say penile rehabilitation. As we discussed in the slides, we use it for patients who may have been less sexually active or have erections that are not as good as that they hoped. There's also other subsets of patients who we also do penile rehabilitation for. These could be patients who have had prostate cancer, for example, and they are trying to regain erections after surgery. They could be patients who have curvature of the penis who are trying to kind of increase the blood flow through their penis as well as straightening. And all those patients can kind of do that rehabilitation with the vacuum erection device, as we recommended, about 3 to 5 days per week, and cycling the blood flow through their penis for 3 to 5 minutes each time for about 10 to 15 minutes per session. That helps to bring good blood flow in the penis, helps to induce that erection, and helps to cause that signaling in the penis to give patients the best outcome. In terms of that, remember with the penile rehabilitation, we are not using the constriction ring, but that doesn't mean that you can't use a constriction ring at other times to be able to sustain that erection for sexual activity.
Alrighty. Next question here. How effective is a VED for someone who has erectile backflow?
Yes, so erectile backflow, remember, is patients who they can get an erection, but they can't maintain that erection. And they can't maintain that erection because blood is leaving the penis too quickly. And also remember that all of the treatments that exist in terms of oral medicines as well as injections, they're all designed to bring blood flow into the penis. So if you have a leaky valve or high outflow, none of those treatments are going to keep the blood flow into the penis. So the vacuum erection device is an excellent way to be able to trap that blood inside. Some patients may only need to use a constriction ring only, However, many patients will want to try to augment their erection as best as they can with the vacuum and then apply the constriction ring at the bottom. And this is a very effective way for patients who have too much blood leaving the penis, a leaky penis, and a vacuum erection device can help with that.
Alrighty. Next question here. Can one become dependent on this method in the long run in terms of using a VED?
That's an excellent question. And I would say that the answer is no. And that goes for the same for any of the treatment options that we have for erectile dysfunction. When people develop a change in their erection, it happens for a reason, whether it be their diabetes or their high blood pressure or their prostate cancer surgery. All of those can cause erectile dysfunction. Why some people think that they become reliant on a medication or a treatment such as a VED is because the instigator of the ED is still there. So that diabetes is still injuring the nerves and still injuring the blood vessels. Therefore, the erectile dysfunction does not come back and does not recover. So in short, the VED is patients do not get reliant on it. It's more of the fact that their erectile dysfunction is still present and not improving.
Alrighty. Next question here. Please clarify if pumping with the VED will not make the penis longer, but may make it wider.
That's a good question. In terms of the VED, there are some scenarios where we do try to use it for lengthening the penis. Those would be patients who have curvature of the penis and we're trying to stretch the penis to get it more straight so that they can kind of go to what they will refer to as kind of their natural straight length. We also use it for patients who, for example, have not had sexual activity for a while and they've developed some scarring in the penis and we want to stretch the penis out. And we also use it for patients who've had their prostate removed. After the prostate is removed, when they connect the bladder to the urinary tube, that pulls the penis in and patients can experience penile shortening. So we do try to use a VED to help to restore some of that length. Are we increasing the penis length by 1 centimeter or large increments like that? No, we're not. But we're trying to do everything that we possibly can to get them back to where they were. The VED, though, can increase the length and increase the girth when you're trying to get an erection. So when you look at your flaccid penis, obviously it's less girthy and less long than compared to when you get an erection. And by using the VED and obtaining an erection, it can help the girth and the length of your penis compared to a flaccid state.
Alrighty. Thank you very much. Next question here. Is it possible, I guess this kind of is a follow-up, but is it possible to overuse a VED?
It is possible to overuse a VED, as we mentioned. We really recommend patients to not use it for more than 30 minutes at a time and also wait 60 minutes in between sessions of use. And there are side effects, as we discussed. If you keep it on for too long, you can develop swelling of the penis or bruising of the penis. You can also develop numbness of the penis as well. And when you talk about erectile dysfunction treatments, you may hear on the commercials or even when you look online, don't maintain an erection longer than 4 hours, for example. The reason is because, as we discussed, when you maintain an erection, the blood inside the penis is losing its oxygen. So essentially, you're keeping blood inside the penis that doesn't have oxygen anymore, and that can be harmful to the tissue inside of the penis, and that can worsen erectile function. So maintaining an erection for 30 minutes is safe, but using the device for longer than 4 hours, for example, is not safe, and that's why I recommend limiting it to 30 minutes.
Alrighty, sounds good. A bit of a follow-up to that, I guess, can some of the extensive use of a VED cause damage to nerve endings?
I would say under regular use, the risk of developing damage to nerve endings is minimal or negligible. as long as you're using it properly and responsibly.
All right. Next question here. No ED treatments have worked for me. Would the VED be a good next step?
The VED is a good next step because there are limitations in terms of oral medicines. Even though you may be taking the highest dose of oral medicine, it is not enough to be able to stimulate the erection that you're looking for. The reason why is because you have to swallow this medicine. You then have to absorb the medicine. You have to use it at the right timing for it to work. And then your body has to be able to respond to it to enough to be able to get the erection that you're looking for. So that's a medically induced erection. The benefit of the vacuum erection device, it puts you in control because you're the person applying the suction at the time that you need it. And therefore, you're applying the amount of suction that you need to be able to produce the erection that you want. The additional benefit of using the VED is that, remember, you're using the constriction ring. So as long as it's not greater than 30 minutes, you are sustaining the erection for the time that you're looking for that sexual activity. So this is a good device for people who have failed other treatment options.
Alrighty, next question here. This person says they've been using a VED for about 3 years. They're finding it to be not as effective now as it was initially. They're wondering, is the problem themselves getting older or the VED?
So you always want to just make sure that the constriction rings are still providing the same amount of constriction as they were at the beginning. These are a type of kind of stretchy material. So any material that we continue to stretch open may lose some elasticity to it. Sometimes these devices also may lose their suction over a long period of time. So you want to make sure that the pieces of your instrument are in good working order. The second and probably the most common reason why erectile dysfunction lose efficacy is going back to what caused the erectile dysfunction. So many patients who have diabetes and developed erectile dysfunction, they feel like even though they're taking the diabetes medicine, that their diabetes is gone and they're not harming their body anymore. But that's completely not true. Just because you're taking medicines, it actually means that your sugars are better controlled, but your diabetes is still there, but to a lower extent. And since your diabetes is there to a lower extent, your blood vessels and your nerves are still being harmed and damaged. And therefore, as your erectile function goes down over time, the efficacy of treatments can also go down over time as well.
Alrighty, next question here. The person says that they cannot achieve a fully hard erection with the vacuum device despite using extremely small rings. They want to know if they should even continue to pump.
Using the vacuum erection device takes practice, and there are several parts that may need fidgeting or practicing in order to get it to work. The bands is one component of it. And the second, and I think one of the most challenging for people is being able to get that right suction against the abdomen. And that's where using the lubrication helps to kind of reduce those air leaks and helps to provide a better suction and contact point with the skin. And some patients, most are going to be able to pump this out without any problem at all in terms of hand strength. There are going to be some patients where it's challenging for them to do all of this in a coordinated effort. That's where we go back to having an understanding partner and trying to incorporate these devices into part of your sexual regimen, because having an additional person, an additional pair of hands may help you to get better success with the instrument if you're not able to do it on your own.
Ready. Next question here. So this person says that the penis pump or the VED tends to suck their testicles into the tube, and they're wondering if there's any tips to avoid this painful process.
Right. The first is trying to exclude the penis as much, exclude the scrotum and the testicles as much as possible. So just a few basic tips is one is we always probably focusing about how can I put this onto my penis in the best way, but maybe as we're putting on the penis, with the opposite hand, we're pulling the scrotum down so it's as far away as possible even from the beginning. The second thing is, as we continue to reiterate, trying to get that best suction. So by using the lubrication on the inside as well as the outside will help to keep it against the skin as best as possible and will help to reduce something from the bottom creeping up inside.
Alrighty, awesome. Can move on to a couple questions about combining the VED with other modalities. So first question here is, can I use trimix with my VED?
This is a question that the response can vary depending on who you talk to. When we use trimix, and trimix is basically an injection that the patient does directly into the side of the penis. The purpose of using trimix is deliver medicine that's like Viagra directly into the penis at a higher dose to be able to get an erection that they couldn't get with Viagra alone, for example. The idea behind using it is that you have to inject into the side of the penis. Now, if you think about applying this device onto a penis that has had an injection to it just a few minutes ago, there is a possibility that some blood could be pulled out of that very tiny injection site and cause bleeding outside underneath the skin of the penis. I would say that that is more of a theoretical or more of a case study type of a warning or risk. And I think that's something that the patients need to consider talking about with their urologist if they have concerns of that. For some patients, that may be the only thing that they can do. So undergoing that very, very small risk may be valuable for them to be able to get the erection that they're looking for. Sometimes after giving the erection, maybe they might want to wait a few minutes and apply pressure to the penis to help to reduce that bruising underneath the skin and taking a little bit more staged approach, not using the device quite right away.
Alrighty, one other VED, another modality question. Can I use a VED to supplement my penile implant?
Once again, that is also a question that I will answer, but also ask people to ask their urologists because some people feel very strongly one way or the other about using a vacuum device with a penile implant. The purpose of, or the thought behind using a VED for in conjunction with a penile implant is two reasons. One is the penile implant makes the shaft of the penis hard, but does not make the head of the penis hard. So the head essentially is a floppy head. So some patients may try to use a VED to help bring blood into the head of the penis, but that's not actually that effective because the blood supply to the head of the penis is a little bit different than the shaft of the penis. So that's not something that I personally recommend to my patients. However, you can have a discussion with your own urologist if desired. The second reason why people use a vacuum erection device with a penile implant is to try to stretch their penis as much as they can in hopes of trying to get some length out of it and to being able to maximize the girth and length of the penis. So there is some literature behind that, not a lot. In my personal practice, that's also not something that I am very aggressive about in teaching my patients or instructing my patients. If my patients have concerns more about length or girth or whatnot, I personally feel that it's better to try to use a vacuum erection device ahead of time before the surgery, try to stretch the tissue and soften the tissue as best as we can before we do the implant, not afterwards.
Alrighty, awesome. I got a couple questions here about VED for different forms of therapy. So can a VED device be effective for patients with multiple sclerosis?
VED is a good option for erectile dysfunction for patients with any diagnosis of erectile dysfunction. for some patients who have musculoskeletal disorders or neurological disorders, such as MS, for example, sometimes there may be some challenges of actually using the device physically. And therefore, sometimes it may be more beneficial to involve a partner in how to use the device and in order to get it steady, in order to use transferring the constriction band from the transfer sleeve and so forth.
Alrighty. Next question here. Will a VED help someone suffering from Peyronie's disease?
So VEDs is one form of stretching and bending of the penis that we do talk about with patients with Peyronie's disease. Peyronie's disease is curvature of the penis. And for these patients, they may curve up, down, left, or right, or even a combination of two directions, which we call biplanar. The idea of using the vacuum erection device is to be able to stretch that penis as best as we can to help to apply a pressure to it so it can help to reduce the curvature of the penis. The other scenario for patients with Peyronie's disease is that many of them also have erectile dysfunction as well. So we are trying to bring good blood flow into the penis to help to rehabilitate the penis. And some patients are not only going to use a vacuum erection device for stretching the penis and reducing the curve, but they also may need to use it for sexual activity, and they'll use a constriction ring for that as well.
Alrighty, awesome. We're gonna have time for about one more question. If we don't get to your question tonight, I'll give you an opportunity to follow up after, but the last question for tonight is gonna be a good follow-up one. What are the pros and cons of a battery operated, or let's say deluxe version VED versus the manual pump VED, which we have discussed a little bit tonight?
Sure. I think the first thing comes down to costs, and everyone is in a different financial scenario, and they may be limited in terms of what type of device they can get. The mechanical or manual version is going to be cheaper than an electric version, typically by a few $100s. And you can look at the website that MedMD has to learn a little bit more about the cost differences, but that's probably the main thing to consider. After the cost difference is more of a coordination scenario. If someone feels that they have a partner that's willing to help them through this process and excited to help them through the process, then you may not need to spend money on the battery powered device, because you have someone who's willing to provide another pair of hands to be able to utilize the device if you have any challenges with it on your own. So that'd probably be the second concerns about the manual dexterity, but fortunately most patients don't fall into that category. The last part is just going to be consumer preference, which device the patient wants, which one device makes a person feel most comfortable. And I think that's a very important component, because in order to engage in sexual activity, you need to feel confident, you need to be smooth about it, it needs to feel natural. So whichever of the two devices makes the patient feel most natural, most comfortable, and most smooth about it, is fine with me.
This is a little bit of information about Dr. Chung and how you can get in contact with him if you are in the greater Philadelphia area. So I would like to thank Dr. Chung for taking the time to present tonight, and we'd also like to thank everyone for listening in and attending this MedMD The Focus webinar. If you'd like to learn more about VEDs, you do have a few options. There are more resources in the Resource Center, medmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you have a question and your question may have not been answered tonight and would like to speak to someone else in person, you can call MedMD at 857-233-5837 or log into the password-protected MedMD portal to schedule an appointment with a personal health assistant. If you're interested in purchasing a VED, such as the one described tonight, or learning how much they cost, you can do so by visiting the shop page on medmd.com, or again by calling our office at 857-233-5837.
Thank you for the opportunity. I hope everyone found it educational, and please reach out to MedMD as well as myself if there's anything that we can help you with.